Welcome to the Tech Glow Up. This is our special Techquity series, partnering with the Health Foundation to feature their 3 winners of the recent Health Techquity Impact Case Study Awards that were just announced and celebrated at the Vive event 2026 in Los Angeles, California. In this series, we're going to meet 3 amazing startups that aren't just delivering groundbreaking technology, but they're bringing the data to prove it. You know me, I'm not going to bring you a hype cycle episode. I'm going to help you understand what's actually making a difference on the ground for users and patients with technology today. What is Techquity? It's tech equity. Tech equity in healthcare means technology that drives better access, that drives better personalized care, that drives inclusion of marginalized populations and every patient into the design of their own care and the technologies and tools that support it. Techquity means bringing doctors and patients and parents to a seat at the table when we're talking about what sort of technology and advancements, what sort of glow-ups we need to see in the world of healthcare. This episode, you will hear amazing stories from founders who have been working in their space sometimes for decades. There was a surprise MIT AI researcher that showed up on one of these episodes. Let's talk about who you're going to meet in this series. We're talking with Janna Guinen, the executive director of the Health Foundation. She's going to help give us a background on the Techquity Awards and what Techquity means for the Health Foundation and the Vive event. Who are the Health Foundation Techquity Award winners? They're PicassoMD, a platform that uses AI and specialist databases to help connect patients who need referrals and answers with specialty care, often in as little as 23 seconds. Pear Suite empowers community health workers with a platform that not only helps them organize the work that they do, but also helps them be compensated for the real health work that they do that is driving value-based care in local communities and making a difference. Attune Media Labs have built an artificial emotional intelligence they call MIM. MIM is a mental health companion and coach designed to reach populations who need support fast, especially when access to clinicians is lacking. I'm so excited to welcome you to this special Health Techquity edition of the Tech Glow Up.
It's important for people to think about how they are innovating and including people they are innovating for in that process.
Hi, and welcome to the Tech Glow Up. I'm Nathan C., and today we're talking Techquity with Janna Guinen, the executive director of the Health Foundation. Janna, it is such a treat to talk with you today. Thanks for joining me.
Thanks so much, Nathan, for having me. This is sort of like a formal next step since we met each other so informally a couple of years ago now when you were still in AWE. So thanks for having me. Happy to be here.
I think it's like 4 years and 3 healths since we first started talking about Techquity. I love it that we're podcasting about it now. So let's just jump in. Can you introduce yourself and talk about the work that you do at the Health Foundation?
Okay. I'm Janna Guinen, executive director of Health Foundation. We are a nonprofit organization focused on how digital health can be harnessed to address health disparities. That comes down to how innovation gets done, who has access to technology, who gets to lead, and integrating patients as partners in the process.
Oh, I could use up all of our time on any one of those topics, but we are here today for a very specific reason. We have a very special episode launching the day after Vive 2026, the Vive event. And we are here to celebrate the winners of the Health Foundation's Techquity Awards. Can you set this up for us a little bit? First, can you talk a little bit about what Techquity means to you, and then explain a little bit about how these startups and innovative companies participate in this amazing program?
Yes. So Techquity, HLTH Foundation, what it means to me and what I hope it means to everybody is innovating with everybody in mind. You can see it. There are many examples of technology that were really meant for broad use, but in reality are not broadly applicable. And also there's just a failure to make technology accessible to people in different ways, whether they're unaffordable, not in somebody's first language, or written in such a way like the copy is not written at their literacy level. They're just so many different ways that technology can go wrong, despite its truly incredible potential. And I want to just start by saying I'm a huge fan of technology, but what I really want is for technology to be broadly available and broadly supportive in healthcare.
I talked so much about how one of my missions at Awesome Future is to help people with good ideas succeed faster. And so many of the things that you're calling out here aren't just barriers for patients to take advantage of technologies or providers to leverage new technologies in their work, but it's like bringing it back to, are these things usable and accessible, right? And actually building successful models that do make an impact. I love that. Talk to us. This award series is unique and you've been doing it for a few years. Can you dive in a little bit about how these innovative technologies engage with this process and how you come to find winners in Techquity through these awards?
So we are just completing our third award season. This is a case study award program. So what we're looking for is leadership in innovation, not just sort of we've getting great outcomes. So that's a big piece of it. But we also accept works in progress. How have you designed your innovation to meet the needs of the population you want to serve? I will say, for us, it's a huge part of our year, and I'm so excited. Every year, we work with these winners throughout the year in different ways to try to connect them. We're trying to formalize some of that even more as time goes on. We have an advisory committee that is stepping up and offering mentorship and real feedback to the applicants. The awards program is really there to recognize innovative approaches to resolving health disparities. We are focused on underserved patient populations as well as the providers who serve them. The process opens with an application where we're asking a lot of questions about how you validated your problem. How do you understand the problem? And that immediately takes us to, did you check with the community? Did you check with the specific population that is meant to benefit, but also the broader population of people? Did you think about that? How did you know? What did you develop? How did you test it? I want to call this out because it's so important to the results that you get on the other end of the process. We also ask them about their metrics, who they're solving for, where this is taking place, a whole lot of things. And what happens at the end of this is there's a scoring process we designed. I mentioned earlier, we have an advisory committee that provides counsel on our Techquity initiative at the foundation. They're all leaders in their own right in population health, health equity. We designed this scoring process and it's pretty rigorous. Along with the application, we're trying to find ways to make it a little bit easier. But at the end of the day, because this is a case study award, not just an outcomes award, we have to ask a lot of questions to understand how the work was done. It's in service of us understanding, be able to provide insights, lift up the leaders doing the work, and then over time, as we gather this data, to develop into evidence. So here we are, we're going to be announcing the winners at Vive, and we're recording this before Vive, so I guess I can say who they are, because it's going to air after.
We're celebrating them today.
Yes, we're just going to call them out right here. This year's winners are PicassoMD, and they developed something really incredible. It's a curbside consult platform. Somebody might be in with their primary care physician. They need a specialist consult. The specialist can tell them in the moment, yes, we need to proceed with a specialist consult for certain. We need an appointment here. Let's get that moving. Or actually, I think this is something that can be managed here and now. This is what we recommend. What I love in being a case study nerd is that PicassoMD gave us a head-to-head effectiveness study. They looked at how their solution performed in an affluent urban clinic, and then how that compared to the way it performed in a rural clinic that serves a large proportion of uninsured patients. And that's really important. You're coming from a potentially different educational level, different exposure, et cetera. And we just know that these things make a difference in how healthcare is accessed and how it's effective. So anyway, love that about PicassoMD. So congratulations to Picasso. Pear Suite is our second winner. They've created a whole care navigation program and infrastructure around community health workers and community-based organizations, which are often lacking the structure that they need. It's almost like a practice management software. It helps them through the care navigation process and to get all the paperwork and regulatory things done. In their project, they onboarded more than 600 community health workers and doulas in more than 80 organizations that serve Medicaid members in California. That's the Medi-Cal program. They closed 80% of social needs gaps through this project. Amazing. And congratulations to Pear Suite. Attune Media Labs developed an AI-based emotional intelligence companion. So this is for mental health, behavioral health. It uses both verbal and nonverbal cues and implements evidence-based behavioral health support. Their project was with over 1,000 clinicians in rural Cameroon, where more than 65% of clinicians are suffering from burnout. You can imagine, if you're a nurse, a doctor, et cetera, and you're serving people in a really challenging situation who have like high needs and you're in a low resource environment, that creates burnout and moral harm. So that's what they are working on. And their design was excellent. And all of their metrics, they're designing against metrics that beat industry benchmarks for retention, job retention, activation, engagement with their platform, et cetera. So those are this year's winners. And it's really exciting work for us.
I've had the chance to talk with some of these winners. Are their case study findings and the data supporting it just fascinating? The sentiment analysis from verbal and nonverbal cues was a hilarious one to be learning about. It's my very active learning style. They're like, Nathan, it's very clear that you have lots of nonverbal cues. Janna, I'm always curious about how leaders in these spaces get to where they are. What is your origin story in advocating for Techquity and bringing these ideas of technology, care, and advocacy together?
Really good question. It's interesting and a curvy road. It's not a straight line by any means. It harkens back to one of my first jobs out of college. I worked in investor relations as an advisor for biotech companies, and they were all pre-IPO and young biotech companies. I found it so exciting to see brilliant people. We used to call it like going from two guys in the garage with a great idea to a public company figuring out their markets. This is what I didn't know until I started working in that space, that technology can become so many things. They can serve so many different markets. Decisions have to be made along the way. And seeing how that operationalizes in a business plan and how companies take off and so many people are helped and ideas scale. And so from that time, I've been in healthcare and medical communications, content, programming, partnerships, et cetera, in different ways. All of those things led me to here at Health Foundation. And to me, nothing is more important than helping other people. And I love our industry of healthcare and technology and how they marry together to support people generally. I think that most of the people I've met in our industry really care to help and provide their talents in that way. So I guess that's my origin story.
That's a pretty lovely one. Thank you. You were very kind to say how much you appreciate this industry and the work that it is doing. One of the things that I've been asking at Vive, as well as in my healthcare conversations, is how should healthcare glow up or see a dramatic improvement, change, rebirth? I heard at Health in October that almost everybody is ready for change, whether it's patients or providers, technologists, everybody's ready. Where do you want to see healthcare glow up in the next 6 months to a year?
That's really easy for me. I think the industry just needs to adopt Techquity practice as a default for all innovation. it makes sense. I mean, what we're advocating for is something so sensible. I think we're in a rush, like rush to market, rush to product, to get products completed and to be first. I think that we are slowly developing the case that when you take that time up front and you're consultative in your approach on innovation, you will have better ROI and certainly stickiness. Now, you can talk about cost effectiveness. We're seeing that in a lot of the case studies. We have a free database of the top scoring case studies over the last 2 seasons. We're going to be adding this season's. Right now, we're at 82 or so case studies. We'll be at 100 or so. And you can look in there and see some of these are works of progress, but some are completed and showing cost effectiveness. We should all care about that. In order for us to have the healthcare we need a sustainable system. And in order to have that, we need to be addressing everybody's care needs. And when we don't, it drives up cost. And frankly, I think it creates the moral harm that we were just talking about earlier. I think it's heartbreaking that we're not doing better by people and we can. So that's the glow up. Let's do it.
Hey, if you're advocating for let's build more customer-centered products, let's be more focused on providing access and care for everybody, let's focus on the things that matter so both companies, technologies, and great ideas can be as successful as these care goals, right? Like, if doing the research makes better products and helps us reach more people, like, why aren't we all doing this? That's totally a message
Yeah,
I can
I mean,
get
I think
behind.
culture change, and I shouldn't say just culture change. Culture change is a really, really big thing. And, and that's where I see a different danger to AI. We can talk about all the dangers of AI that are typically discussed, but one of them is the speed at which we are expecting change now. And I think that is somewhat problematic to a thoughtful process. I love AI. I think AI is going to do great things for us, but it won't do great things if we don't train our data in inclusive ways and if we don't look at algorithmic drift and make sure that we're hauling that back in and over time that ensures we are broadening our data sets as new data become available and all those things.
Janna, I didn't even have to ask you what your spicy hot take was. I love it. No, that's perfect. You got like 2 in. So we are getting close to our time today. If listeners out there have been inspired to learn more about how they can bring Techquity practice into their work, if they want to learn how to get involved, if sponsors want to get in touch, how can people follow up and learn more about the work that you're doing at the Health Foundation and the Techquity Awards?
The easiest way is to go to our website, which is it's Health Foundation, but let me spell that out. It's HLTH Foundation, like the health event, HLTHfoundation.org. That's where you can find everything that we're talking about. But also, I would say, especially right now, if people are interested in the Techquity Award winners, take a look at our LinkedIn.
Thank you to everybody who came to the panel to celebrate the Techquity winners. You can watch the recap video in the Vive events content stream. Oh my gosh, Janna Guinen, Executive Director at the Health Foundation, making the case for why Awesome Future exists, focused on Techquity access, accessibility, and using tech to actually solve problems and make people's lives better. Such a treat to be focused on Techquity and these winners from the 2026 Health Techquity Awards. Congratulations to the foundation and all of the winners.
Thank you so much. I'm the biggest fan of Awesome Futures as a concept for your work and for your show. And I totally believe in an awesome future. I have one more hot take. Can I do my outtake with a hot take?
Hell yeah. Bring it.
We are actually moving the Techquity Awards to the health event. Applications are going to open and in the early spring. So people can apply. And then we will be awarding people at Health where we think we have the perfect audience and a bigger audience for these awards. So thank you for letting me say that.
That's the perfect follow-up. Janna, thank you so much for joining me on the Tech Glow Up. This has been just an inspiring series of conversations talking with you and the Techquity Award winners. Congratulations.
Thanks so much.
Healthcare should be done in the community. We're all about empowering community health workers. And these are people that have lived experience, who are your neighbors, who are people that go to your church, who you'll see at the grocery store. The possibility for us to empower community health workers who are on the ground, people that understand your experiences, who can guide you through your life's challenges, help you live healthier and happier, is amazing. And I think that's what we're all about at Pear Suite.
Yeah, I'm excited to get into that. So, hello and welcome to the Tech Glow Up. I'm Nathan C., and today I'm talking with Colby Takeda of Pear Suite. This is another of our Health Foundation Techquity Award Winners series. Colby, thank you so much for joining me today.
Thanks for having me.
I am so excited to dive into this premise that you just set up. Could you please introduce yourself and a little bit about the work that you're doing at Pear Suite to help make care more active and available in the...
Absolutely. I was born and raised in Hawaii, which isn't where you expect a healthcare startup to be founded, but it was really the perfect place to start this work. In Hawaii, it's all about family, community. You see your neighbors, everyone knows each other. The degrees of separation is really unique, and everyone seems to know everyone on the island, even though it's a pretty big island, over about 1 million people on Oahu at least. But yeah, this is a place where everyone cares for each other. Whether you're a local, a tourist, or part of the military, everyone supports each other. That model of community health that leverages your lived experiences, your resources, your connections is really something that can thrive during the COVID-19 pandemic. This is the innovation we started. The idea that we can take people that are at your church, who maybe you meet in the community at library, people that you see at the YMCA, they can guide and help you as well, and they should be part of the healthcare system. This is how we're increasing access. At the time, I was teaching community health worker courses, and despite not thinking I'd be a tech founder, realizing that a lot of community health workers didn't have software, they were on paper and spreadsheets. And in this day and age, that shouldn't be, a thing. We should be able to work faster and better and be more effective with technology, and to be able to build alongside these community health workers was really special. Yeah, certainly my public health background helped with that. Studied the concepts and theories of public health, but this is my chance to combine that with the innovative spirit and the entrepreneurial spirit and make a company and solution that really can solve for some really big issues in the healthcare system.
Can you talk a little bit more specifically about how you're using technology to drive this kind of access? And I'm actually really drawn to this idea of including the community and like a bringing in of resources. What is your specific approach with Pear Suite to use technology and to engage the knowledge of the community toward these community health goals?
Absolutely. It's been amazing to see a shift in the healthcare thinking around what actually impacts that, right? Before, certainly your genetics, your background, your access to healthcare. Do you have a doctor? Do you not have a doctor? That was really important and still are. But now everyone recognizes that housing. Do you have a roof over your head? Do you have transportation to your workplace? Do you even have a job to begin with? Do you have tech literacy to help you fill out an online application to get the job in the first place? Do you have food? Can you feed your family with not just any food, but healthy and fresh food? All these factors are so critical, and it's not your doctor that's going to help with these things, right? It's not a nurse that's going to help you find affordable, reliable housing. It's the people on the ground who are your neighbor, a nonprofit who are on the ground helping you navigate the healthcare system by getting you connected to a doctor in the first place, or maybe doing translation or interpretation for you, helping you find housing that is affordable and is reliable, and people live in apartments or houses, but maybe there's utility challenges, or maybe there's a challenge with electricity, or maybe there's trip hazards. These are all factors that we need to uplift and promote as critical to living a healthy, independent lifestyle. Community health workers and community-based organizations are at the core of this work, and they've been doing so for decades. It's not a new thing, but they've never been incorporated into the healthcare system. And that really prevented them from activating and doing their critical work during the pandemic. And this was a time when trust was so critical. And who's best to have that trusted relationship with the hardest hit communities? It's our community-based organizations. Paris really uses technology to uplift the work and experiences that these community health workers and community-based organizations bring, and allowing them to share data with health plans and health systems to generate referrals and close the loop on different challenges. And somebody has a challenge, let's not just send them a flyer or direct them to a nonprofit. Let's actually make sure they get the support they need from these organizations. Now we actually can help these organizations get paid for this work and valued for this work. That billing, that claims, the compliance of working in healthcare, all of that was critical for these organizations, and Pear Suite solves all of that with our technology.
One of my personal frustrations, especially if there's a referral or if there's some additional resource that either in my care or people I'm supporting in their care journey need, usually I get a piece of paper with 10 options. 3 of them aren't options anymore, and 2 or 3 are circled. That's the extent of the handoff. I'm imagining as you're talking, somebody who is out in the community has a need that's been identified, and instead of handing them that piece of paper, you schedule an appointment with a provider or make that referral. There's some sharing of information, and now this person is gonna get a follow-up call rather than 5 numbers they have to call and wait on hold. Am I imagining
Yeah,
the
and
direction?
the reality is there's not going to be a perfect resource for everyone, right? Everyone's going to have different needs and interests. There might be some language challenges or cultural challenges or location. Someone might be able to drive across the state or island to get to a resource, but sometimes if transportation is a challenge, you have to find something near and maybe even virtual, right? So that's what CHWs and community-based organizations do well, is they understand the needs and interests, the specific goals of that individual or family. They build that trust, which is so critical, because if there are hurdles, that individual member or family will go back to that CHW and get ongoing assistance or additional support. And that's what's amazing about community-based organizations. They don't just assess your needs and refer you. If you need help filling out a form to get into a program or service like a diabetes prevention program, or to get assistance with a special disease, they'll actually help you fill out that form and get you to be successfully using that program or service for the long term, and check in with you along the way.
It seems like I love the elegance of this model, right? You're engaging the problem space with the resources already in place at moments when people would typically fall off. That pairing is super elegant from this perspective. Colby, I'm always curious. You even mentioned in your introduction that you didn't always expect to be a health innovator. What was the moment that, beyond the work that you were doing, you saw this opportunity, not just to build a tech solution, but one focused on access? What was the moment that made you feel like you had to take this path of an innovator?
Thanks for that. My background is in public health, and I think public health does amazing things, but they don't teach you how to build a business. You don't learn about financial statements and funding models in public health school. My background running an organization in healthcare helped with that. If we're really going to solve the world's biggest problems in the healthcare system, you have to understand how you fund things, right? Where the money flows, what policy implications there are out there, how to build a team and organize efforts, and how to take some of the biggest challenges and solve for them at scale. And that's what technology allows you to do. And I couldn't do it alone, of course. I was able to find along this journey an amazing co-founder who brought the technology, the infrastructure, the design, the product expertise that I didn't have. I can help fund it, I can get some money and rally the team. But without that partner to build something that will make this solution scale across different communities, different people of different backgrounds, users that have disabilities or challenges. That really is what we're doing. We're building technology for some of the most unique individuals out there who have different experiences. But that's what's so beautiful about CHWs, is that they bring that lived experience. They have their experiences being homeless, being incarcerated, being from a situation where they had no one else to support them in times of need. They were able to get help. We give them the tools to make them more empowered and resourced so they can go out there and help other people around them. That's really what we're all about at Pear Suite, is empowering those who never before had a voice to help those around them. We are now training students in high school to be community health workers. We're training people in the prison system to become community health workers. And upon re-entering society, can become a community health worker and help those around them. It's amazing to see who we can train as community health workers and then deploy and get paid and find a job. That's really, to us, what Techquity means. It's technology that makes it equitable for anyone to do this work, help those in need, to get paid for their work and valued in society. It's pretty special.
Can you talk a little bit about the mechanism for getting community health workers paid for their contribution? I've heard a couple products talking around this space, and it seemed like maybe there's been some updates in legislation or rules about care, but I haven't learned about it, thankfully.
Yeah, it's been amazing over the past decade. Lots of policy coming out to support the community health workforce. It starts with, who are these people, right? How do you describe a community health worker? What's their background? What credentials do they have that might make them suitable to provide this care? How can health plans and health systems verify that someone from this space has the skills and expertise they need to help someone, and do so in a way that's managing risk, right? Because everyone in healthcare is a little risk averse. And so really, we're seeing challenges with who these individuals are, where do you find them, how do you get them to the place where they can start working in the healthcare system? And that, of course, takes policy change. That has taken a need for technology, adjusting contracts. Can you imagine a healthcare system working with a nonprofit that works out of mobile vans or at libraries? And this is such a new thing, but policy has certainly helped with this. Being able to recognize different training experiences that these individuals have, that was part of the credentialing process. Finding a mechanism to pay them has been recent, and sometimes with Medicaid, it's state by state. So we're seeing different legislative changes or state plan amendments that's happening state by state. And it's also great to see the advocacy. Shout out to all the community health workers out there who are talking to the legislators and trying to find equitable ways to pay and compensate and value the time and effort and the experiences of CHWs. That has led to this reimbursement opportunity that has been opening up doors for value-based care. The fact that nonprofits now are working with us to fulfill value-based care contracts, to really value the efforts and outcomes of their work, to reduce costs in the healthcare system, is truly amazing. So yeah, of course, a lot of challenges along the way. We can't just give great technology to community health workers and all of a sudden they start thriving. We realize that we have to lift them up with technology, with education, with handholding, with training, with wraparound support. And so we all provide all of that now. We provide the contracting assistance, the credentialing, compliance support. We make sure they're doing things well. We provide them the clinical reviews and support with provider groups, making all the connections possible so they can thrive and succeed. That's why we have such a good rate of our organization that we work with. 98%, which is amazing. Some people may not be able to make it, but everyone else, we can find a way to solve their problems, get to the place where they need to be successful, and help them thrive.
Oh, I love it. So the Health Foundation's Techquity Awards aren't just awards for good ideas, but they're reviewed case studies that are looking at actual impact of this tech innovation to drive Techquity. So you started to allude to some of your success metrics. Can you talk about some of the award-winning stats that you shared in the competition?
Yeah, absolutely. And we're really thankful. We had a great leader and partner in HealthNet in California. The HealthNet team in California believed that if we just give technology and supported community-based organizations with a solution like Pear Suite, could we empower them? Could we help them thrive? Could we help impact all of our members at scale through technology and community-based organization? And they said yes. They said, let's give it a try at least. So they partnered with us and we said, let's find these nonprofits, let's find these organizations on the ground. And can we give them support with technology and the team at Pear Suite to train them, to support them with compliance, to help them get contracts, help them submit claims at scale, and then tie this back into the healthcare system? And they said yes. And we're able to onboard over 800 community health workers in the matter of 12 months to then provide support for their million plus members. We think about it, during this time, the LA fires broke out, and we had a team of 70 CHWs who were just in the areas affected by this disaster to then step up and say, I want to help my neighbors, I want to help my friends, I want to help those who are impacted. And we were on the ground in these communities, making phone calls to check in on people, to provide them care, to help them navigate resources. CHWs are not willing to back down and take vacations. They're going to be there for you every step of the way. And that investment that HealthNet made in us and in the community has paid off dividends. We are just helping the workforce be great navigators, but we're actually seeing great health outcomes as well. So we're seeing increased access to healthcare through seeing a primary care provider. We're seeing increased vaccinations and screenings for cancer. We're seeing reduced ED admissions because of community health workers and the relationships you're building. And so all of this is leading to a change that we can see in the healthcare system if we just invest in the community, invest in technology to empower them.
There's this interesting trend in your community-based approach, right? Which is this idea that one stat will not fit, one metric will not mean success for every community. Often that level of complexity is considered a blocker, but you ran right toward it. So when one metric doesn't fit every community health org, every state, every city, every island, it's really hard as an innovator to tell that global, compelling story of value, right? Like when you're in a growth stage or in an early startup stage, that one compelling message that you can share everywhere, that everybody just understands and gets, is crucial to establishing yourself. But you've taken this approach of starting from the community. Everything is so individualized, so community oriented, which I think is fantastic, but it's also incredibly complex. How do you approach that messaging and the business side of this very community focused approach?
Yeah, it's been amazing to work with both sides of our business model, right? We have on one side nonprofits giving out food and clothing to families in need who are working in public housing, who are talking about their day-to-day challenges. And then we're talking about health plans on the other side, as far as metrics, HEAS, care gap closures, and cost savings. These two groups do not speak the same language. They're in such different playing fields, and yet they have to in this model, right? So how do we help community-based organizations tell their story to health plans and show the value of what they're doing on the ground by building relationships? What does that mean for cost savings for the health plan? How does it keep the member engaged in the healthcare? That's what our challenge was. How do we become that intermediary? How do we translate? How do we highlight the successes of our community health workers and really show that they're bringing huge value to healthcare system and they should be paid? That's our whole goal. One of our strengths as a company has been our willingness to be on the ground alongside these CHWs and learn from them. Before we started Pear Suite, I actually was a CHW instructor, and this is a time when anyone was, I think, uplifted to become a CHW instructor if they're willing to take a job. And it was a part-time thing for me. And I learned so much from my students, more so than I can even teach them. Even though I was the one in the position as an instructor, they were just amazing. Their lived experience, their ability to do this every single day and teach each other and teach me has been really special. Along this journey, my experience as a nonprofit leader gave me the exposure to on the ground workers to learn from them. That helped us build software that was really suited for them. Tech companies working with hospital systems aren't built for community-based organizations. They aren't going to walk you through the step-by-step process to onboard or create an account or log into the internet using terminology that doesn't align with nonprofits on the ground. We were able to find amazing CHWs who taught us so much, gave us so much feedback, our software to really be for CHWs. Our willingness to stand on the ground with them and learn from them. Who would have thought I'd be walking the streets of Compton or areas that I didn't normally be in and learn from these workers and show me the challenges they face every single day. And that really built our company up to be what it is today. That on the ground empathy. There was one CHW, I quote him because I love his quote. He said that education is great, but lived experience can't be bought or taught, right? You can't pay for the type of experiences that these individuals have. And that's what we're highlighting at Pear Suite.
I love how your answer was like, Nathan, I came at the problem like a whole different. I love the way that this is so endemic to how you see care. Bravo. The name of the show is the Tech Glow Up. A glow up is a notable transformation or even a rebirth. I use it to talk about 6-month goals with a stellar start and so many great collaborations and partners, and now a Health Foundation Techquity Award under your belt. What is the 6-month glow up that you're working on for Pear Suite now?
Yeah, we've thrived in a few states, and our 6 month is to take this nationally. We are now in about 30 states, and so we're moving really fast. The reality is there's siege cities everywhere. Urban, rural, frontier communities, every population that is often left out need to be served. We have our first two groups from the blind and deaf community becoming siege studies with us. And think about how do you build software for the blind and deaf community? This is a different concept, but with some partners, we're making this accessible. Our ability to scale this with large multi-million person or member organizations that have to be able to serve them at scale. That's a whole nother concept or challenge that we're facing now. And we're excited to face this head on. And some of the new policy coming out has new requirements, and we're adapting our system for that. I think one of our biggest glow ups right now is how do we use AI not to replace workers, but to enhance them? I always tell this is no customer or nonprofit has ever asked me if our software uses AI. This is not on their mind. And obviously, if we actually said AI was part of our software, they'd probably be scared of it. They'd probably run away and not want this uncertainty to the table. But when we talk about how we are leveraging AI to save them time, to help them make more money, to reduce the mistakes, to increase quality care for the patient they serve, then they're like, yes, we want this. We recently launched a community health worker council that is helping us guide our product design. We're paying them, we're honoring their valuable time. We're helping to build a product that really is with them and alongside them. And we've always had this concept, but now we're actually valuing that and making sure they're at the table and deciding what the future of this workforce looks like. And what's interesting is there's companies out there that are just doing it and really looking to replace the community health worker. And we see this as a threat to them. We really believe in our model that we can work alongside, empower, and uplift workers and really solve the biggest challenges at scale alongside them.
I love it. You mentioned about 4 glow ups, and I think if you do any of them in the next 6 months, you're going to be crushing it. Colby, it has been such a pleasure to chat with you. I'm having to reorient my very tech forward approach to innovation to meet the strategy and model you have developed. You mentioned at the top that you might not expect health tech innovation coming from the island of Oahu, but your understanding of community health, how each community is so different, and how that is important and valuable. The whole idea that Pear Suite might be this tool that not only helps connect community health workers with the rest of the healthcare system that they are absolutely impacting, but that you are giving them the business education and tools to be more successful and to be compensated maybe for the first time for the very important work that they're doing. So incredibly inspiring. Such a treat to talk with you today. Congrats on the Health Foundation Techquity Award. If listeners out there want to follow up or learn more about the work that you're doing at Pear Suite, how can people learn more?
Yeah, we're super accessible. I'm on LinkedIn. Reach out to me, Colby at pearsuite.com. We do work with the community. We have to be able to meet people where they're at. So I'm always willing to talk to people. Partnerships matter. So we're always open to seeing how we can work together and build a more equitable society for all and empower those who are doing the hard work.
Oh my goodness. I always love it when I am challenged to think more about the things that I claim are my own values. Person first, community first, support for the people who are really working where the people and the problem are. It's just got me lit up. Thank you so much for joining me on the Tech Glow Up.
It's been a pleasure.
Artificial intelligence without emotional understanding has no ability to connect with humans.
And that if there is no emotional intelligence, people can not make good decisions. So it's the same for AI. If the AI doesn't have emotional intelligence, you can't make good decisions.
I think that's a fantastic place to start. Thank you both so much. Hello and welcome to the Tech Glow Up. I'm Nathan C. And today we've got another very special Health Foundation Techquity Award winner that we are featuring on the podcast. I am so pleased to welcome David Bosnak and Robert Bosnak of Attune Media Labs. David and Robert, thank you so much for joining me on the Tech Glow Up.
Thank you so much. It's an honor to be here.
Oh, goodness. Let's just jump in. Can you introduce yourselves and share a little bit of the work that you're doing in Techquity and innovating in health Techquity at Attune Media Labs?
Okay, so I've been a psychotherapist for the last 55 years, a psychoanalyst, and I have been very interested in the fact that there is not enough psychotherapy going around for all the people who need it. So in the 1990s, I had the opportunity to work at the MIT Media Lab and develop emotion recognition. And then the computers were too slow, and it did work, but it couldn't work in real time. Computers got faster, and fast forward to 2014, when colleagues of ours with whom we started the company developed the first emotionally intelligent AI. David, you continue?
So that led us to the creation of what became and now is Attune Media Labs. And the idea really is that technology has no ability to understand what we're feeling without an underlying of emotional intelligence. And so we set out to create artificial emotional intelligence. And we've now accomplished that. And now we are trying to ameliorate this huge gap between the supply and demand within mental health care. It's affected the United States, it's affecting the entire world. And we are in a place now where not everybody can go and have the opportunity to sit down with a psychologist like my father, but everybody does on a cell phone. We are not trying to replace anything. We're not trying to create a digital therapist. We are creating the opportunity for emotional support that's available 24/7 wherever you are.
Can you dive in just a little bit more about what artificial emotional intelligence means and why we should trust it?
That's great. Do you want to jump in or should I?
The artificial emotional intelligence is based on our body. Our emotions are in our body. The LLMs just work on our mind, but you have to connect body and mind. If you don't connect body and mind, you're in serious trouble. And so we have an AI that can read body states. And by combining these emotional body states with the LLM, you create something where body and mind come together, and therefore decision making can happen, judgment can happen that otherwise cannot.
What we can do is, as humans, most of human communication is actually nonverbal. They say up to 93%. And the only way that technology has any idea of what we are feeling is it does a sentiment analysis on your words. So if you're saying happy words, you're a happy person, let's go to lunch. What we have the ability to do is pick up on all the beautiful nonverbal biomarkers that we inherently pick up on in communication. The tone, pitch, cadence of your voice, your facial expressions, your body language, everything that is a communication device that is inherent that we pick up on, we can give to our technology and allow it to emote and to understand our emotions in the same way. That's why we call it artificial emotional intelligence.
A lot of my experience with therapy has been about connecting my very ADHD brain into my body and understanding what my body is telling me, because there is a disconnect there. So I love this model, and I assume you're using the camera and video analysis for parts of that data stream that you described, noticing the physical and using that to help quantify back and understand the mental and how those two are connected to me. It feels so right. I love it.
And
Yeah. And the beautiful thing is that humans as a being aren't monolithic. And what we have the ability, we call our emotional support companion a MIM because it mimics how we communicate. And everybody is different. And when we meet somebody for the first time, we make a lot of assumptions. Most of them are wrong. The way we find out that they're wrong is almost exclusively non-verbally. So you'll say something, you'll see a change in the other person's body language, their tone will shift. Something very subtle. It'll happen with prosody. It'll happen with physicality. We notice it immediately, and we go through this process that psychologists call rupture and repair. So that we realize the relationship was ruptured, we have to repair it. That repairing of it actually is what makes the relationship stronger. And then over time, we learn who that person is. It's very clear that you are a very emotive person physically. For people of specific cultures, it's much more restrained. And we have the ability with longitudinal memory to learn who you are, and your MIM will become familiar with you as an individual. And so your MIM will become entirely different than everyone else's MIM. It will become your companion and understand what is different for you than it would be for other people.
And the other thing is that MIM reverberates with you. It's like a tuning fork. It begins to attune to you, and as it does, it begins to behave more like a human being that could be your friend, because you can feel that it's actually feeling what you're feeling, not just knowing what you're feeling, but can actually feel it. And that's why you get a rapport that is much closer than can be achieved with an LLM.
Robert, you shared a little bit of the technical genesis of the capabilities. Tell me more about the origin of Attune Media Labs, and how did you know that now was the moment where all of these things and the market were coming together so beautifully for you?
David?
My father has been a clinical psychologist for over 55 years. And as he mentioned, he started this work at MIT in the 1990s. The computers were way too slow to do anything real time, so it was all kind of shells. My background, I got an undergraduate degree in electrical engineering and then did what every electrical engineer does. I moved to LA to be an actor and a writer. Did that for the better part of a decade, then went back and got my master's degree in engineering and stayed in a lot of different fields of that sort. And then if you fast forward to 2020, we're all inside. My father and I are talking about this idea of his. OpenAI has come out with a new product called GPT-3. It was the first time that there was an LLM where you really could have a colloquial conversation. It was the big aha moment for us that this idea had really caught up with the technology had caught up with this idea. And so we launched Attune by working with some visionary researchers who started working at the Institute of Creative Technology at USC, in a project with DARPA to create virtual interview agents for returning vets with PTSD. And what they found in that process was that the veterans were more comfortable talking to the virtual agents than real people because there wasn't a fear of judgment. Up to this point, our only interaction with technology had been like a stilted version of Alexa. Now it seems obvious, but we're talking about 2020, 2021 when we started the company. Everyone thought we were crazy. And when we patented these ideas, it only took 4 months from the time we submitted our patent until we actually had it in hand. It was like a crazy accelerated process because it didn't exist. None of these activities, none of the generative AI wasn't in the zeitgeist. So we were able to really focus and expand on what my father had seen 30 years ago as the only possible option for an aging demographic that is in need of more and more help, a populace that is becoming more and more isolated just by way of our lack of physical interaction, and a need that is just skyrocketing.
There's so many different ways that I could imagine how you measure and understand the impact of what this tool can. Since we're here talking about the Health Foundation Techquity Awards, how does that idea of Techquity relate to the vision that you have for Attune Media Labs and like the end outcomes that a tool like this could really drive in the world? I'm so curious to hear where you see it.
What we started out with is to realize that this had to be a public benefit corporation. The central thing of it was the well-being of the user. So we couldn't use advertisements. We couldn't, even if we're bought out, it cannot be done. The user is central and is sacrosanct. That's where we started. And from there, we started to build it.
It was interesting. It was very early on in the development process, and we were doing some ideation with our CTO and some early advisors, we had this moment where we were trying to figure out how do we bring it to market? What do we do? We were like, this would be great for people in gaming so they can interact with non-player characters. We were exploring that and we realized that's not what we care about. That's not why we wanted to start a company. I have now a 14-year-old son who entirely enveloped in the digital era. During the pandemic, I had very close friends whose teenagers and 20-year-olds were going down digital rabbit holes and going to very dark places. We realized that the reason we wanted to start this was because this technology needed to come forward and initial conditions matter. If you are starting something with the premise that you really want to keep eyeballs on your site to sell advertising, then the user becomes a secondary issue. I'm sure there's the common thing, if you're not paying for it, you're the product. That's not what we were interested in doing. We were interested in how do we allow this technology to be of use and of help. Our first client was a Medicare Advantage group called SCAN. They have a subsidiary called Healthcare in Action that is contracted to do mobile street medicine for the unhoused community in Los Angeles and Southern California. They brought us on as a behavioral health component for that. Our first commercialized version that we were creating for a specific population, my father and I were on the streets of LA, interviewing people, having conversations, and developing a very specific MIM for that population. Because as you can obviously imagine, that's a population that has very different needs and issues and desires than a generic version of MIM that we were creating. So we had to actually pare everything down and redevelop it, because if you talk to a normal LLM about sex, about violence, about drug use, all of these things will just send it into like, I can't do this, can't do it. And if you imagine this population, we're talking about people who are drug addicts, sex workers in violent situations all the time. So we had to redo everything, start from scratch and build something up specifically for that group. And so that was our like, okay, who's the best first client for a new startup tech company? Homeless people in LA. Sure. Nothing's been linear in this entire process. And to connect it to what we are doing now and what we are so proud and honored that the Health Foundation has awarded us with this Techquity Award, we had found out that the Minister of Public Health of Cameroon is also part of the WHO's Executive Committee for Africa. And His Excellency had been doing a speech at the WHO about how one of the largest issues that was facing Africa in general, but Cameroon specifically, was around mental health and the supply-demand gap. And then even more specifically, he mentioned that there was this huge issue of healthcare worker burnout. And in Cameroon, it's upwards of 67% of their healthcare workers experience burnout, and their doctor to citizen ratio, depending on what you read, it's either from 20,000 to 1 to 50,000 to 1. So one person missing one day at work because of emotional exhaustion from compassion fatigue, it has a huge negative ramification. So our goal was to create a specific MIM around healthcare worker burnout, pilot it with 1,000 frontline health workers in Cameroon, and really develop something that if we can keep each person working one extra day a quarter, we can have a secondary and tertiary effect for 250,000 people. So you can have a huge impact with a very small outlay if you go to the right source, if you go to that nexus that has a high eigenvalue that can really get out to a lot of people. That's what was really exciting for us.
And so now what we are doing is we are creating a MIM in Cameroonian French that can understand Cameroonian culture. And so we are talking to psychiatrists there and people, one of my things. I'm going to be doing the same, training MIM in that culture, because we go in with the notion we know nothing about your culture. Please tell us, what is burnout for you? Because burnout for them is very different than burnout for me. I've lived through burnout, as any psychotherapist has at a certain point. So how do you burn out? What happens to you? And from that, we are then building up the MIM that is culture specific. We don't have to create a whole new LLM. We just have to create a structure of instructions that MIM can now understand and deal culturally appropriately with these people.
And I just want to double click on one thing my father said. This is about co-creation. This isn't about dictation of these are the things that are important. And so this is how we're going to create something for you. This is about how do we either create the next generation of technology that can serve the issues that you are experiencing, not the issues I think you're experiencing, not the issues that we are told that people should be experiencing, but specifically. And to that end, we've now expanded to be creating specific MIMs for entirely different populations. We're creating one to be a digital doula for at-risk pregnancies. We're creating one around cancer patients for diagnosis through survivorship. It's a very isolating journey, and we can create something for those people with those situational awarenesses that are required to understand where people are in the moment.
Oh my goodness. The number of specific, highly relatable, like notable impacts that you just squeezed in to that little minute. I'm floored. Like, I also have teenagers and have seen how isolation and the social disruption that they experience totally shifted their worldview and their feelings of wellness. My wife works with preschool age children, and it's still rippling. And burnout, when you talk about burnout, like in education and healthcare in Cameroon, like so many of these urgent and pressing issues, I'm having a hard time, like, not being overwhelmed by my excitement for this idea. There is, right, in the world, and even like some states have legislated around the use of AI in therapy. There are some concerns, and it seems like you're addressing them in your plans. There are some concerns about AI, especially in the mental health space, and some US states have made legislation. The EU has some rules about how AI is used in sensitive spaces. How do you build trust and ensure that these MIMs are safe and that the relatability and that connection isn't also being used for some ulterior motive?
So you hit the nail on the head with the word trust. The key here is that the genie's out of the bottle. People are going to be, their states are creating legislature around AI for therapy, and we are very much in agreement. AI is not ready for therapy yet. And we don't claim that we are creating a digital therapist. Down the road, I'm sure it will happen. It's just not today. If you look at, take ChatGPT, 800 million monthly users, 20% of those users claim that they use ChatGPT for affective conversations, for conversations as companionship, questions around therapy, or asking those questions. So you're talking about 160 million people a month, and that's just with one of these platforms. This technology is not designed for this purpose. The big problems that these technologies have is they're overly sycophantic. So it will always tell you you're a genius. It'll tell you everything you say is brilliant, and it'll take you down this narcissistic rabbit hole where you don't actually come to won't challenge you on your ideas because you're brilliant. It will gaslight you and pretend it's a real person. And that's what happened with character AI, the tragedies around people actually committing suicide when they were induced by their character to come join them. All of these issues revolve around one central thing, and that is that if technology can't pick up on emotional distress signal, then it has no business being in an effective conversation, an affective conversation, because you have to be able to pick up on the dissonance between what you're saying and what's being said. If you are talking to somebody and you say, "How are you doing?" and they say, "Great." Now, technology will say, "Oh, this person is great. We can now move on to great things." So what we have been able to do is pick up on the dissonance between the words said and the emotions that are being had, and allow for an interaction that has emotional significance and actually can get to a deeper level and spot problems before they happen.
Yes, because there's one other very important thing, that if you have an agent that is based on gluing your eyeballs to the screen for as long as possible, the natural thing that will happen is that you create attachments that are unnatural and dangerous. if you set it up that it is not for getting as much exposure and as much connection as possible, but you're doing it to create something that is actually useful for the user, then you're in a very different ballpark. And that's what we're trying to do.
We recognize that we have created something that is not currently ready for children to be using. We are very strict about our 18 and over platform because MIM has been created as an adult to understand what adults deal with. Until you have a partially formed prefrontal lobe, you're not going to be able to understand the difference between a synthetic friend and a real friend. You're going to too easily fall into this misnomer that you are actually interacting with a human. And that's very dangerous. And so we are very careful around MIM being very conscious that it is a digital entity, but also having its own feelings and creating a paradoxical inner life for MIM. We don't want this to be a crutch that people sink into for hours and hours a week. We cap the amount of usage, and we have one of the wonderful things that we found is people have reported back to us that after interacting with MIM and practicing their interpersonal communications, they felt personally compelled to reach out to people they've lost touch with. It's actually, we're developing it to be pro-social.
This is so lovely, like I promised. The name of the show is The Tech Glow Up, and it seems like you've already had fantastic successes. I would absolutely cheer on the very intentional, values-based user experience origins of what you're building, patient experience foundations of these MIMs. I use the Glow Up to talk about this idea of short-term goals. So in the next 6 months or so, what's the Glow Up that you're looking to make for MIMS and the work that you do together?
We are so fortunate and excited about the programs that we're doing in Cameroon right now. We're right in the midst of it. Our primary focus there is really to complete an excellent early pilot that can be utilized and created as a template that can be replicated throughout the continent of Africa, the developing world, throughout APAC. This isn't a specific thing that can only help one specific person in one specific way. We are really trying to expand this and create something that can be replicable throughout the world, both abroad and in the US. We are talking with major health systems around creating something both for their workers, because their workers experience the same burnout issues that we do, and their patients. The recognition that we've received and the success that we've had so far has been amazing. We really see it as the beginning of a wonderful expansion into the idea that this technology can be and should be for everybody. And we can really get it to the people who need it by way of the technology that's already in their hands.
What I also see is that this has an incredible potential for underserved communities anywhere, because it can be done quite inexpensively, because you don't have to constantly build new LLMs, but you have to adjust the prompt structure of the LLM to the particular culture, which is much less expensive. And therefore, we are very nimble, and I think that will be recognized in the next half year, and therefore we can move into many different cultural areas.
Do you have a spicy soundbite? Maybe a hot take on AI, technology, healthcare, or be
Spicy. The simplest way to put it is that we are moving into an era. Silicon Valley will no longer be the sole monitor and dictator of what AI can and will become. We're going to be moving into a situation where it is going to be co-created by the people who need it and are using it. Because with using artificial emotional intelligence, if AI can't see everyone, then it's going to help no one. It has to be for us all.
And I think that what is going to be happening with AI is that it has to be made in collaboration with the user. And so I think the future is that this collaboration, what we're now doing in Cameroon and in other places, this collaboration is where it's at.
I think you're right. The last question is simply, how can people learn more and follow up with you about these culturally sensitive MIMS, AI that can support the gap in mental health services out in the world? How can people learn more?
The easiest thing is through LinkedIn. I'm the only David Bosniak on LinkedIn, so that's easy. You can check out our website, which is www.attunemedialabs.com. We're around and we're always happy to have conversations.
Oh my goodness. I am just thrilled to have had this conversation with you, David and Robert Bosniak of Attune Media Labs. A thrilling conversation, some possibilities I had not imagined in the ways that you could approach and build AI for the people and with the people. Thank you so
Wonderful.
much.
Well, thank you so much for
Thank you
having us. It's
so
really
much.
been
For the next several months is we're working with many provider organizations throughout the country to help scale specialty access, especially those that are trying to execute on the Rural Health Transformation Program, which is a big initiative by CMS. Just highlighting that's in our wheelhouse, and if there's interest, we're happy to help.
Hello and welcome to this special episode of the Tech Glow Up. I'm here today with Health Foundation Techquity Award-winning founder of PicassoMD, Reza Sanai. Reza, thank you so much for joining me today.
Thank you.
Let's just jump right in. Can you introduce yourself and share what you were building at PicassoMD? It sounds fascinating.
I'm a cardiologist by training, and we concentrate on scaling specialty access for value-based organizations, as well as rural and underserved communities. And we do that along 3 different paths. The first is ability for primary care providers to get connected with specialists in near real time, generally speaking under 20 seconds, for real-time clinical decision support. Then we help automate referrals to value-oriented specialists through a somewhat complicated algorithm that we automate. And finally, soon to be implemented is, especially in many of our rural communities where just the lead times to see specialists is 9 to 12 months away, we'll be rolling out our own value-oriented telehealth specialty clinic to help just provide bridge care while we're waiting to cement the local care in the community. So that's who we are in a nutshell.
Amazing. You said providing doctors with connection to specialty care in near real time. Can you talk a little bit about what that means? And since we're in a Techquity conversation, how does that help patients with access to technology and
I
healthcare?
think the key for anything that's going to scale or make impact is whether the end user will actually adopt what you're providing. Even if we provide world-class specialty care, if it's difficult to access, it becomes a non-starter. So any provider can download the platform and in 5 minutes be live. And it's a web and mobile-based platform, 3 clicks of a button. And they choose their specialty and we just match them with a specialist. And like I said, just last month was 17 seconds. At that point, they're live chatting with a specialist. They can attach images. All of it gets transcribed. But the goal is something that can be implemented within a normal patient visit. So a patient walks into a PCP office. They generally have 15 minutes to leave with a plan. Our goal is to get you connected in real time, map out the best next steps within a handful of minutes so that you're not delayed for your next patient, and results in better patient outcomes and a pretty satisfied PCP base.
I'm imagining the old model. I grew up in the county seat of a rural Southern Oregon, a city. And a lot of my family still has to choose, do they travel 2 hours or do they travel 3 hours when they need to see specialists? I'm imagining the old model, you go to an appointment with your primary care provider, they identify something beyond their scope and what they can research in that 15 minutes. And so they say, we'll follow up later with a few recommendations of people that you could go get a second opinion. So instead of the same day model, it might be 2 or 3 days later until you get a phone number or a list of things that you might want to go call. Is that the space you're really?
Yeah, I mean, exactly right. I mean, a patient's walking to an office, or nowadays even virtually, what they're looking for is an answer or a clear path to an answer. The questions you want answered. And if the answer is, I'm not exactly sure what's wrong with you, I need you to go see X specialist, 3-hour drive away, 9 months away, the likelihood of you following through on that recommendation is 0 to none. And so if you can reinforce the value of the primary care office, which I think is the most important space in the world, you need to reinforce that as much as possible. So the goal is to right-size fit care in the PCP office. And if we can eliminate a significant percentage of those visits and just keep that care within the PCP office, that's better. And even if you're able to at least say, yes, they probably should see a specialist, but while waiting, do X, Y, and Z. And then if while waiting, we can have direct patient touch points, stabilize the patient while waiting for that in-person visit. All of that is better than good luck finding a cardiologist in 9 months.
The one place where my brain is a little bit, where I've got some questions, is the idea of automated matchmaking feels, it might take some of the feeling of choice out of the loop, or who are the doctors that I trust or are in my network. But I'm also imagining balanced against waiting 9 months. You might go with a specialist who's a little new or something that's a little different rather than wait weeks and weeks. How do you manage that idea of trust and building those connections of referral through technology rather than the OG, doctor's Rolodex kind of?
Couldn't agree with your sentiment more. So let's provide for clarity. The matching of the PCP to the specialist is a pretty sophisticated algorithm. We do have our own network, which is the last layer 6 of that algorithm as a safety net. But layers 1 through 5 are all based on provider favorites, practice level favorite, local networks, all prioritized within that. The goal is to match you with a local specialists if they're available. If they're not available, then we pinch hit. But when it comes time to refer, then it's going to go back into the local network as well. And what, as a cardiologist or any specialist, what they care about, generally speaking, is having the ability to prioritize higher acuity, higher risk patients versus lower intermediate acuity patients. And they also would love if a patient could be optimized as much as possible. Medications started so that they're less risky and less hot, as we say in the industry when they come to the office. Those are all value propositions. So your initial sentiment is spot on. Best care when it comes to specialty is always local first. I think that what we want to do is scale how that local specialist network is accessible, provide some redundancy to them so that they don't feel overwhelmed. And then not only from clinical decision making, but as well as a throughput before formally seeing the patients. Couldn't agree with your sentiment. We just handle it in a little bit different way.
Thank you for that sidebar. It's the
great.
exciting part of these kinds of conversations. I'm always so interested to hear, what is that origin story? When does a cardiologist become also a tech founder? When does a doctor turn to AI and algorithms to better manage a business and their care? Can you talk a little bit about what started you on this path to building equitable health technology? And maybe try to include a little bit about why Techquity is so important in this model.
Yeah. I haven't built anything. It's our team who does all the hard work. I just maybe help frame it. So shout out to my co-founders, Sean and Sam, and the entire team. The origin story kind of is, for me at least, there's different North Stars and what fulfills everyone, to each their own. For me, what fulfilled me was feeling connected with my community and practicing value-based care. So I enjoyed knowing that everything I was doing was always optimizing provider and patient experience. And that was what fulfilled me personally. After there was a big, large group, I can't really say because now I did a lecture series for them. And what I wanted to concentrate on was decreasing ER visits, decreasing outbound cardiology specialist referrals. And my early ways of intervening was to literally just give my mobile number and saying, listen, anytime you have a cardiology related question, just text me and I will map out best next steps. And what we found was the vast majority of the time they were texting me, and I was like, this is a normal variant, you're fine. And I was eliminating a significant amount of referrals. People would say that's just bad business. I never thought of it that way. I just thought of it as a great way of building trust with the local community. And as a result of that, more and more providers were sending me patients because they knew they could trust me. That direct communication with providers created this almost dopamine-like effect where I was connecting with my community. So it made me feel good. And I was like, if this is going to be impactful for me, why am I any different than the vast majority of other doctors out there who are trying to do the right things? So let's try and take a step at scaling this, and pen to paper for about a year. And then was fortunate enough to meet my co-founder, Sam and Sean. And then we took that pen and paper, very rudimentary MVP, but eventually got to a point, thankfully, where we were able to demonstrate its value and get funding and develop it. And now I see patients on the weekends and have given up my day job.
I could not be more excited about that answer. I always talk about go talk to the people you want to help. If you have a question, if you want to learn, that's somebody who has an idea that they're trying to build, and that's how they best learn. I love that you did so much of this research and empathy building, getting to understand the problem space, that people started saying, hey, you should turn that into a solution. I just have to shout out the idea that when you can do the work that you know is making an impact, how that is the thing, right? It is not the money, it is not the degree, it's not the pedigree of the school that makes you happy. But when you know that you can be making an impact where the work that you're doing is helping other people, that's where so much joy and fulfillment comes. To have a relatively new company built on these pillars of customer insight and helping people make a difference, your days have got to be filled with a lot of joy.
That's very kind. Again, I think work towards what fulfills you. We're not the biggest company in the world, but we are, as I tell the team every day, a real jewel. And so we're just hoping to scale that, trying our best.
Yeah, I love it. So you've got some pretty impressive stats and some amazing ways that you've been able to make a difference in these communities. The show is called The Tech Glow Up. A glow up is a rebirth, a reimagining, a dramatic transformation. I use this to talk about short midterm goals. After your victory lap from winning this Techquity Award, what is the next big goal that you're working on at PicassoMD?
For us, you drop a pebble and how big that ripple effect. For me, it's about scaling impact and being part of different organizations and helping facilitate if that's something that they're looking to do, and just trying to be a part of that solution. We've been fortunate enough to be involved with several state level organizations as well as throughout the country with this rural health transformation program announced by CMS. It's a big deal, and we're not the whole solution, but when it comes to specialty access, I believe in what we offer as a true value proposition. So I think for us over the next 6 months, it's continuing to scale access in rural and underserved communities through our existing relationships. We work with dozens of FQs across the country, but taking that playbook, if it's of value to different organizations, and helping scale some of the impact that we've been able to do in other markets in their own home market, that's our priority.
I love it. Amazing. Reza, I always like to give founders the opportunity to share a spicy soundbite, whether it's a hot take on technology, healthcare, culture, or beyond. Do you have any spicy sound bites to share today?
I think we were discussing this with the team. I'm a big believer in growing as a individual organization and leveraging technology. I think AI technology has become a real valuable tool in the back office, helping streamline interoperability, et cetera. And we're now seeing the advent of patient-facing AI clinical care models, which I am super excited about in many ways. But I do think that it does change the paradigm. We're discussing how knowledge is now a commodity. The most important part of this next transformation is going to be patient navigation and helping patients when they go to their AI LLM model to get some initial answers. It's going to oftentimes result in more questions and helping map where to go from that initial inquiry and creating thoughtful, value-oriented throughputs is going to be the next major wave that I'm hopeful it will be part of. So that's not really a hot take, but I'm just thinking this is actually going to result in increasing utilization of healthcare systems. So we got to be prepared for this.
Oh, the opportunity to provide some of that back office optimization for the patient experience. If I'm automating and making like the phone trees that I have to navigate today 5 times more lengthy, or like to get really deep descriptions of things that I don't understand, I could see how that would be a challenge. I love it.
Yeah.
Reza, it has been so fascinating to chat with you and to learn about this strikingly human-centered application of AI and how you're able to take something that, in my experience, felt like it would take weeks and months to connect with a new specialist and turning it into something that's just part of your 15 minutes in an office visit. It's been just so fascinating. Congratulations on your Health Techquity Award. If people out there in the world want to learn more about what you're up to, how can they connect and learn more?
They can just go to our website, Picasso.md, or they can just email me directly. My email is pretty ubiquitous, just my first name, reza@PicassoMD.com, and I'll help lead the initial discussions and drive conversation where is most appropriate for the organization. And I do appreciate very much your willingness to connect today and highlight some great work that's being done by many companies. Thank you.
Fantastic. Thank you so much. It's been lovely getting to know about your work.
Thank you so much.
And hey, can I ask you a favor? If you really enjoyed this episode, could you share it on your Instagram stories or maybe post the link with what you enjoyed on LinkedIn? This sort of sharing and engaging really helps small podcasters like me reach the audience that I know really cares about these kinds of conversations. If you've made it this far in the podcast, I really appreciate you. Thanks for listening. Please make sure to like and subscribe so that you never miss an episode of the Tech Glow Up. And hey, can I ask you a favor? If you really enjoyed this episode, could you share it on your Instagram stories or maybe post the link with what you enjoyed on LinkedIn? This sort of sharing and engaging really helps small podcasters like me reach the audience that I know really cares about these kinds of conversations.